Why cheek filler can make faces look older. Cheek filler is one of the most common aesthetic treatments performed worldwide. But sometimes patients return saying something surprising. I look older. I look heavier. My face looks wider. So how can a treatment designed to make us look younger sometimes do exactly the opposite? The traditional aging model. For many years we taught, aging equals volume loss. Therefore, volume loss right pointing arrow replace volume. This approach works well in selected patients. Examples: temple hollowing, skeletal support loss, deflation of fat compartments, younger thin patients. However, this is only one part of facial aging. The modern aging model. Aging involves bone remodeling, ligament laxity, fat compartment changes, tissue descent, skin laxity, changes in muscle activity. Importantly, not all fat disappears. Some fat compartments enlarge with age. Examples include nasolabial fat, jowl fat, submental fat. Many aging faces become heavier rather than deflated. This is where injectors get into trouble. True volume replacement is usually someone who is young thin face, mid-face deflation, loss of projection. This is the difference between volume replacement and volume addition. A younger, thinner face with mid-face deflation and loss of projection may be an excellent candidate for cheek filler. In these patients, filler can restore support, contour and facial balance. But in a heavier face with strong cheek projection, mid-face descent and early jowls, additional filler may simply increase width and heaviness. Instead of looking younger, the face may actually look older. Why cheeks become wider. Excess cheek filler may produce lateral facial widening, increased lower face heaviness, exaggerated ogee curve, unnatural light reflection, loss of facial definition. Patients often describe this as puffy, bloated, filled, not looking like myself. This is one reason filler fatigue has become common. The anatomy behind the problem. Medial cheek fat, lateral cheek fat, deep medial cheek fat, SOOF, retaining ligaments, tissue descent. Key message: the problem is often not lack of volume. The problem is that tissues have moved. You cannot always lift descended tissues simply by adding more filler underneath them. Who is a good cheek filler candidate? Usually, younger patients, facial deflation, post-weight loss patients, age-related volume loss, loss of projection. Poor candidates include heavy faces, strong malar projection, significant jowls, facial edema, substantial skin laxity. Take-home message: the goal of facial rejuvenation is not to make faces bigger. It is to restore balance, support and proportion. Sometimes the best treatment is filler. Sometimes it is skin tightening, surgery, weight management, or simply doing less. If you want to learn more about facial anatomy, assessment and safer injection strategies, these are exactly the principles we teach at ASI through Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors.